I've been asked to speak on arthroscopic anatomy, and that would be really small. So what I've done is I'll just touch upon the surgical anatomy pertaining to joint arthroscopy, the radiographic anatomy, just to identify the structures in MRI, and we will come to arthroscopic anatomy. Just to give you a perspective of what is medial to the foramen ovale, many foramens, there are very, quite a lot of vital structures that you have to be careful, but then you're not going that medial during arthroscopy, just to give you an idea. And also, if you see this picture here, this tells you how thin the glenoid fossa is. The glenoid fossa is probably 0.2 to 1.5 millimeters in thickness. So you have to be very careful when you do an arthroscopy that you don't puncture into the glenoid fossa and enter the middle cranial fossa. So this image is to tell you how thin it is. And there are many blood vessels around the joint. Since the anatomy has already been discussed, I'm not going in depth. So you have your standard lateral fossa port through which you enter the joint for an arthroscopy. So you have your Coleman-Helsing line, which is there, and you have many other vital structures right next to that. So you have your cartilage over there, you have a superficial temporal artery, vein, middle temporal artery, the zygomatic process is there. You have your nerves, your facial nerve is also very close. So these are the things that you have to keep in mind. I'm not going in depth. So this is the MRI in which you can identify the disc, and the disc is, this is a classic example wherein the normal position of the disc, which is on top of the condyle, the posterior band is at the 12 o'clock of the condylar head. You can see the glenoid fossa here. The disc is like a bow tie, okay, and this is your condyle. So this is in an open mouth position where the disc and the condyle, they have moved forward. So how do you understand whether the mouth is open or not is because you see the EAC here and your condyle here, it's close to each other. And over here the distance is increased, and you can see the retrodiscal tissue here and the disc on the condyle, and it is much more translated anteriorly. So just coming to a few pathology wherein the disc is displaced anteriorly. So you can see that the condylar head is here. Just to give you a perspective first, this is a T2 weighted image because you can see the CSF, it is more bright. Okay, and you have your condyle in the normal closed mouth position, but you see that the disc is forward. That means it's an anteriorly displaced disc. Okay, and in an open mouth position also you can see that the disc is anterior. That means it is non-reducing.
That black thing is the disc, guys. Okay, black bow tie.
The bow tie thing here. Okay, and in this, one more thing that you can understand is that the condylar head has resolved. There is an element of ICR in this. The condylar head is small. The joint space has increased. The disc has displaced anteriorly, and it is stuck over there. And if you see here, there is a whitish tinge over here. That is joint effusion. So in T2 weighted images, fluid gets brightened, it gets more highlighted. So that's a joint effusion. That over here also you can see this is joint effusion here. So now coming to the TM joint. TM joint is divided widely as a superior joint space and an inferior joint space, and what divides it is your articular disc. So to understand how the arthroscopic images looks like, for that first you have to understand what is normal before you understand what is abnormal. So what I will do is each step or each area of the joint, I will show you what the abnormal appearance looks like and how it is abnormal. So there are 7 areas of interest when you do an arthroscopy. So first is the medial synovial drape. Then you have your pterygoid shadow, you have your anterior recess, you have your intermediate zone of your disc, then your disc per se, you have your posterolateral slope of your articular membranes and the glenoid fossa, and the retrodiscal tissue. So first is the medial synovial drape. Okay, the medial synovial drape is the first area that you would see when you enter the joint. So the whole thing is, when you enter the joint, it's like you are entering a room. The first thing that you see is your medial synovial drape, which you have to visualize. Okay, so it's got these white translucent striae which is there, and if you so on top, so this is your retrodiscal tissue which is there, and then as you go medially, you can see the medial synovial drape here. This is a healthy joint. This is a healthy joint. It is, you don't see any pathology here. But if you see a pathology, you can see adhesions on the medial side. So this is an adhesion here. You see that white structure, that is not normal, that is adhesions basically. So that is in the medial synovial trait. And now the attempt is to release it so that the mobility of the joint increases. Or you can also have erythematous patch, okay, or because due to inflammation and the joint is bad. So along with the stria, you see a lot of inflammatory changes in the medial synovial trait. So that was normal and this is abnormal. Then the pterygoid shadow. As you go medially, you see the medial synovial drape, and then when you watch anteriorly is the pterygoid shadow. Pterygoid shadow is basically, you see the pterygoid muscles on the other side, that is medial to the medial synovial drape. Okay, so you may have perforation. The joint is bad. What can happen is the medial synovial wall can have a small rent, and then you can see the pterygoid muscles further. So what can happen is that the extravasation of the fluid can happen into the medial part of the medial synovial trait. Now coming to the retrodiscal tissue. Retrodiscal tissue, you know that it is innervated and it is attached to the posterior part of the disc. So to give you a normal perspective, so that's a pathology. Okay, so you can see that the disc is anterior here, and your retrodiscal tissue here, okay, which is inflamed again. It is red and it's got a lot of adhesions in that, and your disc is anterior here. You can see that all this is bad. It's all chondromalacia which is there, and that is not how the retrodiscal tissue should look like. It is more white in appearance and it is more like fluffy. Okay, so this is bad and this is what is normal. Now coming to the posterior slope of the articular eminence. Posterior slope of the articular eminence, it is basically to understand whether the fibrocartilage is healthy or not inside the joint. So you should have these white, it should be glistening white, it should have these striations on that, and the same striations, it goes on to the glenoid fossa as well. Okay, so this is the posterior slope of the articular eminence that is there, and you go posteriorly and you see the glenoid fossa. But then there are situations where the fibrocartilage may be inflamed and you may have chondromalacia, you may have, you'll see various changes, you can see adhesions. You can see that all these white structures like cotton fibers, that's all adhesions and it's chondromalacia. Moving on to the articular disc. Articular disc, you know, it is white in color. It's got an anterior band, a posterior band, and an intermediate zone. So what you see above is your articular eminence, and what you see below is your disc. And you see this small groove here. That's where the retrodiscal tissue gets attached to the posterior band of the articular disc. This U-shaped depression is where the retrodiscal tissue becomes the articular disc. In abnormal pathology, what we can usually find is either the disc is displaced anteriorly or you may have disc perforations. So this is an anterolateral perforation of the disc, where inside you can see the condylar head here. You can see the condylar head here. And you can see that the fluid is going into the inferior joint space as well. Or you can see the entire head popping out through the, so you have your retrodiscal tissue here, you have your disc here, and this is your condylar head, which is perforated the disc and is coming to the superior joint space. So that's your condylar head. And that's your disc which is perforated. apart from the perforation, the disc can be anteriorly displaced. So there's a term called roofing. Roofing means how much of coverage of the disc is there on top of the condyle. So you can have a normal disc position, that is the posterior band in relation to the condylar head. If the disc is anteriorly displaced, then what happens is that in the seated position, you will see only the retrodiscal tissue. That's because your disc is already anterior. Okay? And in a non-reducing disc, you will never see the disc because it is completely anterior and it is not reducing. Now coming to the intermediate zone is basically the disc that you're seeing intermediate, which is the thinnest part. Even in that region, what can happen is the disc can get thinned out and you may see a small radiolucency in that region. Coming to the anterior recess, so all these things that you saw is in the posterior recess. Now, going to the anterior recess, it's more or less like your medial synovial drape. It is medial, and what you can see there is basically your adhesions or any pathology which is there which you may have to address. So the normal appearance of your, so this is your condylar head, which is, this is your disc which is there below, and this is your articular eminence here, and that's your medial synovial drape. No, that's your anterior recess on the side. And posteriorly, you can see the pterygoid shadow, and then you have your medial synovial drape. This video is to show you how a disc can get buckled into the anterior recess. So this is your disc. Yeah, so this is your disc. This is your articular eminence, and you can see that the disc has buckled in and it has gone into the anterior recess in this region. Or what you can see is, you can see these adhesions over here which needs to be released, which is not normal, which can hinder the joint mobility. These are all features of a degenerative joint disease, basically.
Arjun.
So just to give you an idea of how a normal joint looks like. So you have your articular eminence here, your disc below. This is your retrodiscal tissue. This is the posterior slope of the articular eminence, your disc. The anterior recess, and if it is a degenerative joint, this is how it would look like. You can compare now.